As London locks down, the doors of Dr. Scott Miller's practices stay open.
Here's your baby.
Caring for the animals that stand by our side.
I don't think we can underappreciate just how important animals have been to their owners during lockdown.
How the hell did he swallow that?
Because we've all been isolated.
Hello, boy.
And the fact that they give us that unconditional love and that security has been so invaluable to so many people.
Oh my God.
Luna, what's happened?
I have to say I'm a little bit concerned.
Can't find any more problems in this dog.
In this time of suffering,
It's not great news, I'm afraid, Carol.
our pets have never been more important.
She's the child that I've never had.
And if we'd left it, I might not have him.
This is Lockdown Vet.
Here we go. Oh, going in there, in there. Hi, ladies. Let me introduce you to... It's Biggie, obviously, isn't it? He's my builder's dog, but unfortunately he's got a bit of an embarrassing problem. I know Biggie's owner, Stu, because he is a builder and he has been doing some work on my house. Okay, you got it? Ready? 1, 2, 3. The relationship that I have with Stu is that everything is about banter.
It's the slowest speakers in the world.
He's very funny. Both my wife and I and Stu have become good friends.
Yeah, see, you all took the mick out of me
I
for
know,
getting him,
I do.
and now you all love him.
It's not a dog. It's as simple as that. It's not a dog, but he is cute.
The picture of Stu, this kind of tattoo-covered, motorcycle riding builder guy with his cute little dog, it just makes me laugh. You know, I think it's a really comical duo. And now you're coming of age, aren't you, mate? Is he starting to get a bit amorous?
Just doing that like manly thing, like jumping on people's legs and stuff. Like trying to dry hump sort of thing.
No, he's humping everything that moves.
Yeah, not a lot, but he is like getting up and he's up for it.
But we have to consider getting his balls off him.
Yeah, so obviously we have spoken about it, so it's like maybe it is time.
Should we have a little look and see what you've got going on, hey? Yeah. So, yeah, well, there's a bit of a problem, Stu, and your dog only has one testicle.
Was it definitely only one, or was there one like snuck away? Maybe
Well-
it's keeping one for a rainy day.
Yeah, I don't know where it keeps it, like, unless he's got an internal purse. So what do you think? Should I take you to work? Hey, what do you think, Dad?
Yeah, do it.
Daddy can do some building work and I'll do some deconstructing work.
Oh no.
So I think in this case we're going to have to do a fishing expedition. So sort of like be putting a hole in the abdomen and then trying to hook out the testicle. We need to find Biggie's second testicle because when you know that a testicle isn't in the scrotum where it should be, at 2 degrees below body temperature, it is a recipe for potential mutation. And those types of mutations can lead to cancer.
I've not actually seen one before.
You've not seen one before?
No.
Oh, okay. Do you know what it reminds me of? It's like, you know those, ice hole fishing?
Mm-hmm.
Yeah, it's like that. It is. So basically, just make a little hole and then you just go fishing. Yeah. Instead of pulling out a salmon, you pull out a testicle.
Nice.
Yeah. All right. Should we put an IV in you? I don't think you need to be a vet to realise that little dogs are more fragile. And all small patients, we take a view they're almost like babies. So often we see in the veterinary practice these little dogs that have been significantly inbred, or you've had 2 runts of the litter come together to make even more puppies, and they weren't healthy in the first place. Anaesthetising Biggie immediately became apparent that he was not reacting well to the drugs that we used.
Come on, baby. Have a breath.
He immediately stopped breathing and would not restart. Can you just get a little bit of adrenaline? It's just... And then his heart started to slow, and that's when I started to panic. Just keep breathing 1 every 2. Yep, that's fine. And as you can sort of hear when you're listening to a dog's chest, you can literally hear their heart fading away, and you know their life goes with it, and it is incredibly frightening. Those waves are looking a bit more regular now. Bloody hell, this job honestly makes you go grey.
I think I just aged 10 years.
Yeah. And what's even worse is the stress of when it's someone's dog that you know. It somehow makes it worse. It was having a little look at the Rainbow Bridge there. I think he saw a squirrel on the other side. It's like, so that's the danger of anaesthetics. You know, we deal every day with life and death, and our job is beyond serious. You know, and you can laugh about a little dog called Biggie with one testicle, but it's a much loved member of the family, and when things like this happen, it just reminds you just how important life is, and how important our job is. Okay, so now we have reassuring beeps. I like reassuring beeps. See that? See, I love a beep. People would find that noise annoying. I find it therapeutic. It's lovely. It's like listening to Bob Marley on a summer's day. There is a romanticised view of what it is to be a vet, and then there's the reality. And it's moments like that where it's really pulled into sharp focus. Keep breathing, just keep breathing. That's for you guys and the dog. Where if you make a mistake, it's all on you and that animal dies. And it's quite a heavy burden to carry sometimes. This is going to be speedy ice fishing. This is not ice fishing for pleasure. This is for a specific purpose of catching the infamous testicle fish. It's very likely that it'll be a lot smaller than the other one. Lots of reasons why it's difficult to find. But I've just found it. So look at that. Second attempt. Biggie, thank God, mate. There you go. So you can see immediately that's one testicle and that's another. So, okay. There you have it, one naughty testicle. Okay, so you can see there. So there's Biggie, there's Smalley. You gotta laugh or you'll cry. Biggie now can look forward to a long and healthy future now that we know that the testicle that was hiding away in his abdomen is now out. There's no chance that he can develop cancer as a result of that, and hopefully I can hand an alive and healthy Biggie back to Stu. I'm so relieved to have the ability to wake this dog up. You just be able to hear him breathing and hear the beeping and know that he's okay is a massive relief. Right. You're right, buddy. Hi. Hi. It still gets me every time when animals try and die on you, especially when you're trying to do what you think is the right thing. Good boy, I know. Stu's a mate, and I know he'd be heartbroken if his little dog wasn't going to make it. So yeah, I think pressure's a bit of an understatement. Hello, Trouble.
Hello.
Hello, mate.
Hello.
Hi, handsome boy. Who's this?
This is Camino. He may have some lipstick on his...
He really does.
Yeah, sorry
he's
about
smothered
that.
in lipstick. Whose is that?
Might be mine.
Right. Wow, so he's a hit with the ladies there. Hi, handsome. Camino is one of those cases that, well, makes your blood boil. So this is the dog that we've kind of rescued, is that right?
Yeah. He's 13 years old. You can see he's a golden retriever. And we rescued him from a family who didn't really want or care for him anymore.
He looks quite thin as well. Did I mention, had he been eating okay?
Well, he's been in a garage by himself. And the alarm bell for me was that he didn't fit in with their decor in their home anymore. So he's actually just in a garage 24/7. So no one's really known whether he's been eating or drinking.
He is just a neglected dog who deserved a far better life than what he was given. And actually, there's no reason why he didn't get it. He came from a family that was very financially secure. They didn't let him wee on their grass. He just simply was unloved.
Well, he really is such a sweet-natured dog, isn't he? And I'm sure that we can give you the affection that clearly you're looking for, hey? But yeah, I'm a little bit concerned about how thin he is, and the fact that he is breathing quite fast. He's not too bad. He's got some pretty mucky teeth in there. Cataracts, which is not a surprise, being an old boy. That's the greyness you can see to his eyes there.
Can he see?
He will be able to see a little bit, but it's kind of like looking through mist.
Okay.
So he's going to have old dog problems, aren't you? The thing is, look, this guy, yes, he's got some issues with movement. There's no doubt about that. Oh, and you've got an issue with toileting outside, which is fine. We can sort out that. Let's pull you out of your big poos. It's not a surprise that he's a little bit incontinent if he's been living in a garage and not being walked. But he's such a sweet boy, aren't you? You're a sweetheart. Hey, you. He's got a beautiful golden retriever smile, hasn't he?
Yeah.
Just classic. So I think first things first, we'll take some bloods, Nathan. Do we know what his name means, Camino?
Yes, it means walking.
The irony. Camino the dog that never gets walked. Unfortunately, there is a chance that Camino could be quite unwell. He is an old dog and he's been neglected, so yes, we don't expect him to be a perfect physical specimen, but there's just a few little warning signs here. The fact that he is really out of breath, his gums are a little bit pale, and he's very thin despite the fact that he has been being fed and he's been eating well. So I'm a little bit concerned that there might be something that lies beneath which is not particularly good. Yeah. Okay, so he's anemic, which makes a lot of sense. That's why his breathing is as laboured as it is. Okay, so he's losing blood from somewhere. Yeah, so I think let's do an ultrasound just to make sure that he's not losing blood from anywhere that he shouldn't be.
I have to say I'm a little bit concerned.
Yeah. All right, take it easy. Ready? Come on then. That's it. Good boy, well done. Ready? Oh gosh. Oh, good. There we go. Good boy.
What happens when the gym's closed during lockdown, isn't it?
That's right. You have to pick up dogs and put them down again times 10. Sometimes in old dogs, particularly retrievers, can develop tumours in their spleen or in their liver, and they present as anemic. So it's a pretty good result. I can't find anything untoward there in this scan, which is great. I was a little bit concerned. Thankfully, I'm only finding normal structures present in his abdomen. So it's good news. I think what he needs is just to be looked after and loved and fed well. Okay, come on then, more gym work for me. Ready? Lockdown gym. Okay. Look. Bicep curls. Come on. Handsome boy. Go. Oh, you're a big boy, aren't you?
We were introduced to this dog as a patient of ours. This dog wasn't being cared for and loved in the way that it deserved, and therefore we felt as a practice that the right thing was that this dog should find a new home, and that's what we did.
We are coming to the practice today because we are rescuing a golden retriever. It's nice because we're doing it for the dog, so it's lovely that we can offer him some TLC and a new home for the last years of his life.
It'd be really nice to give him a decent couple of years, however many years that may be.
Here you go, here he is. Hi guys. Hi. This is your new doggy. Say hi. No, I'm not going to introduce him by his name because I don't think he should have that name anymore.
Right.
I think he should have a name that you guys decide. So he's basically 13 years old.
Yeah.
He has some joint issues. He has some sight issues. Now I understand that you guys have had quite a lot of old dogs in your recent history, is that right?
Yeah, we're pros when it comes to elderly dogs and their care, yeah. He can look forward to lots of flat floors, lots of treats, lots of TLC. We basically have someone at home 24/7, so he will never be on his own. He'll have a whole new set of like doggy friends to meet up with.
It sounds like you guys are from the heavens, doesn't it? Really? Amazing. Yeah, Lizzie has been the saviour of this dog, but now, like any good fairy godmother, you've got to, or dog mother, you're the fairy dog mother, you've got to pass on this doggy to you guys.
Yeah.
So, yeah, come on then. Come on, up we come. Come on then. Yay! Good boy.
Yeah, okay, no more lipstick on your head.
Bye guys.
Come on. See you later.
Bye, lots of love. Thank you so much.
You're welcome. See you soon.
See you soon. Bye.
So I've come to pick up my little boy after having been castrated. And yeah, hopefully it's all gone all right. Brilliant, I'm definitely going to spoil him.
Da, 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 da. Here he is. Come on, let's go see Daddy. Come on. Oh, you little tyke. Hello, mate.
Oh, hi. Oh, hello, little man. Oh, look at your silly little cone.
Here he is.
Is he all right?
Yes, he is now. Yeah. So the surgery went absolutely fine, but yeah, he did give us a massive scare because he.
Oh, really?
Yeah. When we first anaesthetised him, he stopped breathing, which a lot of the time.
Jesus.
Yeah, a lot of the time they do stop breathing initially, and then they come right.
Right.
But he just stayed not breathing, and then his heart started to slow. So we had to give him adrenaline and fluids.
I feel I'm gonna cry.
Yeah.
Jesus.
Yeah.
Oh, mate.
It's a funny one when I give Biggie back to Stu because I'm just glad that I can. You know, this is a dog that seemingly wanted to go elsewhere, and so it was just amazing to be able to give him back to Stu in one piece. I mean, minus testicles, obviously, but he was alive.
Yeah, one of the my nurse who is a trainee vet, I think she's thinking twice about a career. Maybe to come into building trade.
Yeah, to be fair, I could do with a hand on a sleeper wall.
Yeah.
Well, thanks.
Yeah, right. Yeah.
Thanks for that.
You're welcome. Yeah.
Biggie's a great little dog. Would I be a Chihuahua owner? I don't think so. He's really cute and really plucky, but, you know, he sort of shrunk in the wash, didn't he?
Bye, lads.
Oh, little man. Come on, dude.
Bye. Today I'm so excited because I'm about to be reunited with the absolutely beautiful old boy. Previously his name was Camino. I don't know what his name's going to be now, but he got to go home with the really lovely Harrison Camilla. Hello, hi, it's me Nicky.
Yeah, how are you?
I'm good. Hello, buddy. Oh my gosh, you look amazing. Wow, you look so good. His coat looks amazing.
Oh, thank you. We've given him a really good brush.
Oh, so we go and see your new house?
Yeah, come in.
Thank you.
Daddy there,
Come on then. Come on, big boy. Well done.
Good lad.
Good boy.
You know my kids, Harris and Camilla.
Hi, guys.
And this is the old boy's new family.
Wow.
Would you like that?
Hi.
There you go.
Wow.
Maybe she'll take that from him now.
Wow, I knew he was joining a family. I didn't realise he was also joining a pack.
Yeah.
Well, look, first things first, I've been dying to know. He had a name before, but I don't think we should dignify that name. I want to know what the family's come up with. So what have you called him?
We called him Doug.
Doug!
We've all, as a family, we've seen the film Up, and the dog in Up says, "I have just met you and I love you." And when Doug came home, that's what he was like.
And he looks so good, doesn't he, guys?
He is very content. He loves his family.
Doug is looking the picture of health. Of course, he's an old dog, so he's got the classic issues of arthritis, which he will have for the rest of his life, but his coat looks amazing. He looks so much brighter. His gums are nice and pink, but he just seems to be a totally different dog. But I think more than anything, you're getting a real happy vibe from him. He just seems
so
really content
happy.
and really happy.
He is really happy. Well, he just makes you fall in love with him. The whole family's falling in love with him.
Should we go for a little walk? Should we go for a walk? Do you know what one of those is yet? Eh? That's where we find a lead. Yes, a lead. A lead. A lead.
Maybe on the third day we took him out for a walk. It was almost like a switch clicked. And he went from being a dog that's 13.5 to a dog that was 3.5. And that was sort of when we realised that he was going to give it 110% every day. And he does.
Is he here as well? Hey, look. Come on.
Doug enjoying the great outdoors. Now he can smell the flowers, he has grass under his feet, he can walk in the fresh air, he can listen to the birds. This is a dog that has struggled with arthritis. He's been quite painful, he's been on cold concrete floors. Well now, what a difference a few months make. He is living in the lap of luxury and he gets to enjoy wonderful, beautiful, open green spaces.
Him being outside is where he's happiest, and he just wants to make up for everything that he's missed out on. He wants to do twice, 3 times over, and he wants to give it his all the time.
Ready? Ready? Good boy. Well done.
Hi, I'm Dr. Danny Dusek. If you love our show and want to see more amazing stories from the Bondi Vet team, just hit the subscribe button. Click that little notification bell and we'll see you for our next video.